Welcome to our Q&A session. Motherhood is an exhilarating experience. But no matter how many what to expect books you read, there is no one manual to parenting. Expectant and new mothers are full of questions regarding the health and well-being of their little ones. And to help you navigate the highs and lows of this roller coaster called motherhood, we answer all the questions that you have by bringing in the experts. For today's session, we have with us Dr. Anil Kumar, who is an ENT specialist. Welcome to the show, Dr. Kumar.
Good morning.
Dr. Kumar, welcome. Good morning. He has 16 years of experience and he's an ex-army doctor. He is presently a consultant at the BLK Hospital in the Department of ENT and Cochlear Implants. His specialty lies in endoscopic sinus surgery, phonosurgery, and head and neck surgery. In today's session, we'll start with the questions that you've sent us. So let's begin and take up the first question, which has been sent to us by Monica. Now, her question is about, scratching of ears. She says, my 1-year-old is always scratching her ears. What could be the reason?
There are 3-4 reasons for that. Most importantly, some child have habit of the scratch the ear. There is nothing inside, but they just have habit. Second is most important is the earwax. They have earwax inside the ear canal which irritate them. We need to clean for that thing. There is some drops come in the market. You can put that and go to doctor to clean it. Third is infection. Some child have infection. They may have the pus also. For that you have to go and show to the doctors.
Okay, so there could be 3 reasons behind why a child is scratching your ears. Look at the options. Worst case scenario, perhaps you'll have to go to the doctor. The next question is from Ships, and this is regarding tonsillitis. She says, my 3-year-old child is getting frequent symptoms of throat infection and tonsillitis. I would like to know the reason behind these symptoms. She is less likely to drink or eat cold items. I am guessing that the child is not given a lot of cold items, but she seems to be allergic. She has allergy to dust and even has skin eruptions which look allergic. What would you advise?
In the smaller child's tonsillitis is a very common problem. Tonsil is a protective organ which helps to protect the child from the infections. So they catches the tonsillitis. 2-3 episode in a year is okay. You have to give the antibiotics and show the doctors. We don't go for the tonsillectomy for 2-3 episodes.
Okay, but the traditional wisdom was when we were younger that if the child is getting repeated bouts of tonsillitis कि चलो निकाल ही दो tonsils निकाल देते हैं बच्चों को बार-बार प्रॉब्लम नहीं आएगी. What is the wisdom now? What is the best way
Now
forward
this concept is changed. We have lot of good antibiotics. We can fight this tonsillitis very nicely nowadays. So we don't opt for the tonsillectomy so frequently. Unless the child have 6 to 7 episode in a year, he not able to go to school, or this type 3-4 episodes, 3-4 years continuously, then only go for the tonsillectomy.
Right. So you're saying 3 to 4 episodes of cold, cough, tonsillitis is normal for young children?
Yeah, normal.
And the parents shouldn't be overly concerned about this. So there you go.
And there is one more part in that question. She have allergy with some skin eruption. That is not related to tonsillitis.
It is not related to tonsillitis. Okay, so 3-4 episodes of cold cough is pretty normal for young children. Don't get alarmed about that. The question that we have next is from Lavanya. She is saying her question is about ear cleaning for babies and till about 4-year-old kids. Her question is, if anything is there in the child's ear like dust, should he clean it or should he leave it? Some people say that one should check the ear every week and clean it ourselves. Some say that we should just leave it like that and there is no need for cleaning. What would you say?
Yeah, our ear have hair follicles. The function of the hair follicles is to remove all dust, wax. So we need not to clean the ear. In fact, we are say people don't use any earbud or anything to put inside the ear. It can damage. It can disturb the normal natural function of the ear.
Okay.
So we say don't use anything. Don't put anything inside the ear.
You're saying that it could be risky, so you should not do it.
Yeah.
Okay. So do not attempt to clean the child's ear yourself. If the child has too much discomfort because of wax, you should perhaps visit a doctor and get it done professionally. The next question that we have is from Yashika. She says, I have 2-month-old twin baby boy and baby girl. My boy is comfortable in the AC, but he catches a cold, and my daughter cannot sleep in the AC. She starts crying when we start the AC. The doctors say that the baby should be kept in constant room temperature as external temperature is very high. What should we do? So the baby boy, um, uh, you know, uh, he gets a cold in the AC, and the baby girl cannot stand the AC. She starts crying. What should the mother do?
First, you have to keep the temperature of the AC is moderate. There is no more difference between the outside temperature and inside indoor temperature.
So what's the point of having an AC? I mean, what should the difference be?
Yeah, difference is that ki we don't go. There's a sorry. If outside temperature is 40 degree, if you cool his body in the 25 degree, your body will be not adjust.
Okay, so you think
Yes.
the differential shouldn't be too high.
Yeah.
Okay.
And you have to wear whole cloth for the baby, that boy baby, so that he cannot catch the AC.
Okay.
And this is not for the that girl baby, but you have to acclimatize the girl baby
But
also.
is it true that babies catch a cold because of the cold air of AC? Is there any truth to it, or is there, some people say you get a cold or a cough because of a virus. It's got nothing to do with the cold air. How much truth is there to it?
Actually, that you go get cold of due to virus. But if your body's immune system is down, if you just
Or not
if a-
completely developed for children
yeah, completely developed, that there is a chance of the growing of the virus is more.
because of cold air.
Yeah, cold air.
So you would say that keep the AC on, so that the differential between the outside temperature and inside temperature is not too much, but keep the baby covered.
Yeah.
So that's the advice coming in. Keep your baby covered and ensure that the differential in the temperature outside and indoors is not too much. The next question has come in from Amita. She says, my toddler's nose always bleeds in the summer. What should I do? It's a scary and a heartbreaking and sight for mothers to see blood on their children. Is this really, really alarming?
No, not at all. What happens that in the summer the air it becomes dry.
Dry.
There is no moisture in the air. So inside there's a that crust is formed inside the nose. That crust causes the bleeding. Okay, some child have to put the finger, remove the crust because they irritate them. So first thing, if there is a blood, we have to pinch the nose for 4 to 5 minutes and say child to breathe from the mouth if possible. And after that we put the nasal saline drops. So
Okay.
that is a no
To
crust form.
moisturize the
Moisturize
side.
and it liquefied the crust, so it is not formed there. And third important is you have to cut the nails of the
Okay,
baby.
the child. But this is not an alarming situation.
Not at all. Not at all.
And this can be handled at home.
Yeah.
Would you also recommend icing?
No.
Does that help?
No.
Just
The ice
pinch-
can help, but what I said, it is more important.
Okay, you
If
need
you pinch the nose, it will be stopped by itself.
all right. Would you then also recommend perhaps using nasal saline on a regular basis to ensure that
Yeah, you can
it's-
use nasal saline. Is a
moisturized.
harmless thing. They don't have any complication, no side effect. So you can use in the summer.
All right. The next question that we have is from Sheila. Sheila says, my 3-year-old boy gets sore throat quite frequently. How can I avoid it?
Sore throat quite frequently is a tricky thing. Sir. Child in the small, who are very small, they have not developed immune system properly. So they have the tendency to catch the sore throat so frequently. You have to if possible, do the gargles. If they are allergic with cold things like ice cream, you can avoid
Avoid.
that.
Okay.
Yeah, but you cannot stop it.
Okay. But are there any specific triggers that can be avoided so that the incidences may reduce?
If you know that if child is allergic to some particular food like curd or oranges,
Okay.
then you can avoid it. If there is nothing, then you cannot do anything.
Okay. So you need to observe your child and see whether there is any specific food or environmental condition that triggers a response of a sore throat. Then try to eliminate that, but really much cannot be done because children's immunity is not completely developed. The next question that we have is from Sandhya. Her question is, what to do if a toddler puts something in his nose? Before I take him to the doctor, is there any first aid that can be done? What she means is that the toddler has put something in the nose and it's stuck. Is it very alarming? What can the parent do? before the child is taken to a clinic or a
This
hospital?
is the alarming condition, but it's not. You have to panic at that situation. First,
No, you shouldn't panic.
yeah. First, keep and calm your child also.
Mm.
Second, observe is actually inside has anything or not.
Mm.
Sometimes baby say that he put something, but it gets out by itself.
Okay.
See it, if you can see it is just on the edge of the nose and there is some paper sort of thing, you can remove it. But if it
Okay.
is inside, then don't do anything. Take it to a doctor so they can remove it completely.
Okay.
Because there is a risk if you put something inside to remove it,
Mm.
it may go inside your windpipe also.
Okay. Anything else that can be done on the basis of a first aid? Anything else that needs to be done? You're
No.
saying if it's on the edge, try to remove it. If
Huh.
not, immediately take to the
Yeah,
doctor.
yeah.
Anything?
Nothing, not do anything because there is a chance of it get inside your windpipe
Okay.
also.
So don't risk it. If it is something that you can't pull out by yourself, rush to the hospital or take your child to the doctor. Divya is asking how to clean infant's ear properly. I'm assuming she is meaning both external and internal inside the canal.
Yeah.
What would you say?
Inside you don't do anything. Outside after the bathing, take a soft cloth
Mm.
and clean your ear nicely till your cloth goes in.
Just cloth or should there be some soap? What
No,
would suffice?
nothing. Don't put anything inside the ear.
No, even on the exterior,
Actually,
just a cloth and
normal
water is enough.
normal bathing. You use soap like on the face. Same thing you wash your
Mm.
ear also.
Mm.
Okay. After that, just clean it with a soft cloth.
And do not attempt to clear the canal of the
Yeah.
ear.
No.
Alright, so do use a washcloth to clean the external part of your child's ear, but do not attempt to clean the canal of the ear canal of the child. Swapna had sent us a question. How do I know if it's time to clean the ears of my toddler? Are there any signs or is there a time period? I think she's again talking about cleaning the canal of the ear. Is there a specific time period that you should, check, look to clear? What would you say?
There is no time period. Nothing is required. Only if child complain like if he eats too much or he cry or he say that there is some pain, then only you have to do something.
Okay. So there is no regular cleaning required of the ear canal. Only if there is a problem with the child should you look to investigate and perhaps take the child to the doctor. Now Chandini has sent us a question. She says, my baby frequently burps milk post feeding. Will that cause discomfort to the throat and how can I take care of it? Now all new mothers are told after feeding your child, put the child up and burp the child so that the child is comfortable. Now the concern here is that because of burping or maybe loud burping, is the throat going to be irritated? Is there, something that can be done to ensure that the throat doesn't get affected?
No, burping does not cause any problem to the throat. And burping is actually required. Sometimes that milk may go inside the ear also because there is a tube which connect ear and nose. We call it Stachyon tube.
Okay.
Especially in the small child, this tube is straight between the nose and ear.
Mm.
There is a chance of the milk go inside the ear and cause
Okay.
the infection inside.
Oh.
Okay. And or maybe there is a condition called otitis media effusion. It may cause that. So we moved to do burping.
So burping would prevent any of this from happening?
Yes.
So you're saying burping is a good thing for children,
Yeah.
it doesn't cause complication to the throat.
No.
Okay, so that's a clarification there. Burping cannot be bad for your little one. Now we have a question from Kritika. She says, what are some signs of ear infection? How can I provide immediate relief at home to my baby? She's, immediate relief before she goes to a doctor. What are the signs of an ear infection?
If child is cry, you can see the pus coming out. There
Of
is
the ear?
Yeah, there is a definitely sign of the infection in the ear.
Mm.
If child is cry, you can give him the paracetamol if you have in the house, which is quite safe. After that, you have to show the doctor. He clean the ear and see what is the condition of the eardrums. If there is definitely some infection, then he have to give some antibiotic drops or maybe oral antibiotics also.
To the child.
Yeah.
Okay, with ear infections, there is always this fear that comes to mothers because what usually I've seen with a few mothers is the child gets a routine cold and cough, and you think that this will go away on its own. Before you know it, it's become an ear infection. And the ear infections makes the child so uncomfortable. There's constant crying. There's fever also that comes in. what is the chance that if you get a cold and cough, you will get an ear infection?
This is nothing different chance. Some child have this problem.
Propensity to
Yeah,
have.
yeah. But most of child does not have.
Okay.
But child who have this problem, he have chances to frequently no common cold and cough converted to the ear infection. So,
Can a parent do anything to stop this in the
yeah,
tracks?
if they know they start when he have cold and cough, they start a treatment immediately.
Okay.
They have to control this cold and cough so that a child ear is not going to affect.
Right. So, are you saying when there is a first sign of cold and cough, treatment should start? What kind of treatment would you suggest then, so that you don't reach the ear infection
Their
stage?
pediatrician must give the list of the medicine when he
Which
has
could
cold and
include
cough.
anti-allergic.
Anti-allergic, most like anti-allergic, decongestant.
Okay.
Okay, some nasal drop also in case of the nasal discharge.
Okay.
They have to start that thing.
So you're saying if your child has a propensity to develop an ear infection after a cold and cough, take measures straight away to treat the cold and cough so that it doesn't develop into an ear infection. The next question that we have is from Ruchi. She says, my toddler gets severe bouts of cold and his voice is almost hoarse during this time. What can I do to help with the pain?
This is common thing when child have the sore throat. They have laryngitis also. Laryngitis is the voice box.
Okay.
They affected.
Mhm.
For that they have to take the anti-allergic decongestant. And if it is the prolonged, then she may require antibiotics also.
Okay. The question perhaps this is coming is because, it's not very easy to administer medicines to kids. Could there be home remedies or something we can give on our own that may be more acceptable to the child and may give him relief from the sore throat and the pain in the throat?
You can give, if child is able to take the warm things like warm milk, okay, some warm food, you can give that thing. But if voice is hoarse, then you have to go to the show the doctor.
Show the doctor. Okay. Anchal has a question. She says, I recently signed up my toddler for swimming lessons. Are there any precautions to take to protect the ears?
Yeah, you can have first use the cap which cover the ears nicely.
Okay.
After the swimming, you have to remove the cap and see if there is any water. You have to use the cotton to clean the water. Don't go inside the canal from outside.
You have to dry the ears.
Yeah, dry the ear. Third, if child have the cold, don't go say to go for the swimming that time.
Okay,
Because
swimming.
our ear and nose canal is connected, the infection may go inside.
Okay.
Okay, and if child have ear complaint, then that also have to see.
You
Because
would suggest to avoid swimming at
yeah,
that time?
avoid the swimming.
Avoid swimming.
Yeah.
Okay. Kavani has sent a question. How to clean infant's nose properly?
Infant nose first. If infant have some problem like he have the lot of discharge, you can use the normal saline solutions.
Okay.
Second, you can make a salt and that baking powder solution and cold it, and you can clean also from with the rubber tube syringes
Syringe.
which come in the market.
Okay.
That is all.
Maybe the question is coming because the child has a cold and is congested. There's runny discharge or there's thick discharge, and the child is feeling uncomfortable, and the mother feels like, the child doesn't know how to blow. So let me try to remove it. So in this scenario, how safe it is to use that suction bulb that comes?
The rubber balloon is very soft. You can use easily. They have you put that saline solution, or that I said the solution made in the home. It liquefied the ear nasal discharge so that it come out itself.
So you can suck it out.
Yeah.
But first you must give the saline solution first. Okay. Then we have a question coming in from Ritu. Are there any home remedies for blocked nose of the baby?
You have, if possible, give the steam to the child.
Okay.
Yeah, especially small child not able to. They are afraid for the steam. Then you also have to sit along with the child inside the towel or anything other. You are using the vaporizer so that he is comfortable. And
so you're saying sit down, take the child in your lap,
yeah.
cover yourself
Yeah.
with a cloth
Yeah.
and the child so that the steam comes to you.
Yeah.
Steam is a good solution.
Yeah, good solutions.
Anything else that can be done to relieve the...
Second is the normal saline solution.
Okay.
That's true.
Any other home remedy that can be given for blocked nose? Why this is being asked is because I myself admit that when my child would have cold cough, I would rub ghee on the chest. I didn't put wigs
Yeah.
because it was not recommended. Ghee on the chest, or little garlic and ghee, or maybe ajwain and ghee on the chest. Does this help at all? Is this recommended?
Yeah, there is no scientific study on this thing, so I cannot comment.
Okay, all right. Sugandha has sent us a question. Is inhaling steam during cold advisable for kids?
Yeah, it is very nice thing. You should give this that steam to the child. Only problem you have the check the temperature of the steam. You do not keep too long to child inside the steam. It can may burn.
Burn. So
Okay.
what is the recommended time? Like I'm sitting.
You also sit and you see it is comfortable for you.
Okay.
If you feel discomfort, then definitely it
The
is
child is
comfortable
also
to
feeling
child
this.
also.
But on an average, 5 to 10 minutes steaming is
5
good?
to 6 minutes is enough.
5 to 6 minutes is good enough. Okay. So, steam is good to decongest even little children. But see, if it becomes uncomfortable for you, it will become uncomfortable for the child. 5 to 6 minutes is what Dr. Kumar recommends is good enough of steam to help in the decongesting of blocked nose. Richa has a question. She says, how to decongest baby's throat and nose? Sometimes a lot of people have this post-nasal drip where the nasal discharge flows back to your throat when you were asleep, and then before you know it, you're even coughing out phlegm and things like that. What can be done to help decongest the child?
For first we have to see what is the problem. Does child have any infections or some tonsillitis or some rhinitis, means infection in the nose? If they have that thing, we have to address. Otherwise, you can give gargles. It is very good for to decongest the throat
Okay.
with the lukewarm water and pinch of salt.
But very small children will not be able to do gargles.
Yeah, I agree. But there is nothing else you can give.
Anything that can be eaten to improve any?
You can
Have
give
your own
one
mental.
thing, but they also don't. You cannot give soup or cold, hot milk to them because
Okay.
they don't prefer that thing. If possible, you should give.
Okay. Rashmi has sent us a question. What are some immediate steps to be taken if the toddler chokes on something? Now, this is
Yeah,
an
it is
alarming
very,
situation,
very
right?
alarming situations. If child chokes, first thing you have to stand the child prone in front, and then you have put your stop on the back of the child.
Okay.
So
So
that
you're saying make the child stand up,
stand
bend
up,
him a little forward, and slap his
slap
back.
it back,
Okay.
so that there is a movement of that particle which choked and come out. Second thing, you hold from back and press in below the chest.
Basically, give a tight hug.
Yeah,
Kind of a
tight hug and compress it.
Okay.
If child is 2 years, 3 years, 4 years, okay. If it's still very small, like 1 year, then you lie down on the bed and compress at the breastbone from the below
Okay.
slowly, so that it propel outside.
Sometimes when the child is very small, and especially when the child is starting on solids and finger foods, would you advise, if you see it in the mouth or in the throat, to put your hand and take it out?
If yes, if you see that it's going to stuck and you can see it, you can put a hand and brought it out.
Okay.
So this is an emergency. You have to do something. You have
Alright.
not time to go to the hospital or anywhere
You
else.
have to act then and there.
Yeah.
Okay, so be careful, and like Dr. Kumar has said, take immediate steps, make a child stand in a prone position, slightly bend his back, and give tight slaps on the back so that the food may get dislodged and may come out. Now we have a question that is coming from Asha. She says, what are some harmful foods for toddlers' throat? Is there something that can harm your child's
Normally
throat?
there is nothing harmful food for the toddlers. Only thing we said that we don't give them nuts sort of things which they can ingest inside and
Then
there's
choke on
chance
it.
of choke themselves, chance to go in the windpipe.
Okay.
So avoid those things.
Okay, so nothing harmful but avoidable is look to avoid nuts that can perhaps end up in the wrong place. We have a question from Shreya. What happens in a throat infection? What are these symptoms?
Throat infection child first cry, they may have fever, they say they are not able to eat anything, there may be the pain in complaint while eating. These are signs of the throat infections. If child have throat infections, first you can give the Calpol
Okay.
for the fever also. and still it is not going to correct it in 1 or 2 days, you have to show the doctor. And if the child able to do gargles, promote to do the gargles with the lukewarm water.
Okay, Preeti says my baby gets red spots on tongue and the back of the mouth when she's down with a cold. Is this normal?
Down with the cold is indicating that your baby has a viral infection. It is not a normal. For
Okay.
viral infection, you just give the paracetamol, it is enough.
And good food and
Yeah,
diet.
good
There's
food.
nothing more to be
Nothing,
given,
nothing
right?
more.
All right. Now, the other question that it's a general question that we have. During pregnancies, there could be cases where expectant mothers, suddenly come down with a sore throat, maybe even sinusitis or an ear infection. What can be done there? Because during pregnancies, the use of medicines is restricted to a large extent. What would you advise?
If we know if the mother is suffering from the sinusitis, we advise to go for do the steam inhalation. It is a harmless thing. Second, we give the some nasal spray. Nasal spray does not go inside the blood,
Hmm.
so it is not
Safe.
not going to affect the baby.
Okay. Anything else?
Nothing.
But just you can take Crocin and
Nasal
steam.
spray. Sir.
All right. So with this, we've come to the end of this session. We want to thank Dr. Kumar for taking the time out to answer all these questions. We hope you enjoyed this session and learned and got a lot of tips on how to take care of your children and ensure that their health and well-being is looked after. Before we sign off, we would like to thank Dr. Anil for taking the time and sharing his knowledge with all of us so that all of us come out wiser. I hope you enjoyed the Q&A session and stay tuned for more updates in our next session.